Pleased to be here at Queen's Park. My name is Katrina Kilroy, and I'm the president of the Association of Ontario Midwives. I'm also a practicing midwife with about 20 years of experience, and I've been to over 1,000 births, so I have seen a few of these little folks. And I'm pleased to be here with Julie Marr from the Ontario Women's Health Network, and with the midwifery client Kate Greenslade, as well as other midwifery supporters and midwives. Particularly on this day, International Day of the Midwife, when midwives across the province and the country and the world are walking today in support of maternal and newborn health. Today we are launching a campaign to expand midwifery care in Ontario through the creation of birth centres for this province. Currently, women under midwifery care have two safe choices to give birth, in the hospital or at home. However, more and more midwives are hearing from their clients that women and families of Ontario want a third choice. They want to have access to birth centres. A birth centre is a family-oriented place where low-risk women can receive prenatal care, have their labour, deliver their baby, and receive follow-up care all in the same location. The birth centre model has been proven to work in Quebec. There's a birth centre soon to open in Winnipeg. There are birth centres across the United States, Australia, New Zealand, and many other countries around the world. The birth centre model is an innovative way to divert low-risk women out of hospitals and into a high-quality and safe option for community care. In addition to the Ontario Women's Health Network, the Birth Centre campaign has been endorsed by the Ontario Association of Community Health Centres, by ECHO, the Women's Health Agency, and by the Ontario Hospital Association. So Julie Marr from the Ontario Women's Health Network will describe how birth centres will improve care for women and newborns in Ontario.
Hi, I'm Julie Marr. I'm the Provincial Director of the Ontario Women's Health Network. And OWHN's mission is to link women to health information and resources and to address the health and healthcare barriers faced by women in Ontario, particularly women who experience marginalization through our research and advocacy work. We want to see an Ontario where every woman has the opportunity to achieve, sustain, and maintain healthy living to its fullest, as each woman defines that for herself. We just recently did a survey of women across the province of Ontario, looking at their health interests and their research needs, as well as their feelings about the healthcare system. And across the board from women, we found that they wanted more options for their healthcare. They want diversity in the services that they're able to access for themselves, their families, their coworkers, and their communities. And one of the things that we found particularly strong in the women's comments were comments about midwives and how much they appreciated midwifery care. Some of the comments that came back to us on the survey were things like more midwifery care for all. Another comment said, Ontario needs birthing centres and more midwives, more home births. The research already shows that home births attended by a midwife are just as safe statistically as hospital births, but most pregnant mothers don't get to make a real choice about where they give birth. Another comment said, license more midwives and insist that all hospitals across Ontario give midwives admitting privileges and or provide medically equipped birthing centres the way they do in Quebec. So there's a really strong feeling from women across the province that this is a service that they want and that they need in order to have the options and choices that they need for themselves and their families. The birth centre model is a really innovative way to divert low-risk pregnant women out of hospitals to high-quality and safe community care. Birth centres will also play a pivotal role in providing access to care for women who experience marginalization, to women where a home birth may not be an option for them, but where they don't really want to go to the hospital, and this will give them an option that doesn't exist at all for them at this point. The healthiest birth for the majority of women is a normal birth, and midwives are experts in normal births. Midwives have lower intervention rates, less use of epidurals, episiotomies, vacuum and forceps births, and less C-sections. And that's a real concern because in Ontario today, almost 1 in 3 births is by C-section. And that's a huge increase over even Ontario's rates in the 70s, where it was only 6%, and Quebec's current overall rate, which is 20%. Many C-sections aren't medically necessary and result in an increased number of complications for women. If women had the availability of a birth centre, they could continue to experience low intervention and C-section rates. Community-based care in birth centers will also reduce the exposure to hospital-based infections, and we've heard all kinds of information about that lately in the media. Things such as MRSA, which is an antibiotic-resistant bacteria, or outbreaks of the flu. When women are admitted to a hospital during outbreaks of infectious disease, they come in contact with patients who are ill. Birth centers would protect women and some of the most vulnerable Ontarians, their newborns, from unnecessary exposure to risk and disease. At a birth center, a woman can expect to receive the same high-quality, safe midwifery care that she would receive in a hospital setting. And as a mother of children in their 20s, I want my daughters and my son's partner to be able to have options for their care. And birthing centers provide a real option that's missing in our system today. Thank you.
Thanks, Julie. So you've heard a bit about how birth centers can improve the quality of care that women and newborns receive. In addition, birth centers will reduce healthcare costs. It's no secret that this is a concern for many of us in the province and in the country, the rising healthcare costs. And we believe that now is the time for innovative solutions such as birth centers. The high quality of care that is provided in a birth center would be more cost effective than providing the same care in a hospital. So that community-based care is more accessible and it's more affordable. Within the midwifery system already, costs such as midwifery compensation, operational budgets, clinical improvements are currently funded through ministry funding. So we already have funding for those components of this birth center model. Those are already in place. So the vision of birth centers, midwife-led, the vision of midwife-led birth centers in Ontario is an expansion of the way that midwifery is already run in the province. Birth centers could function as midwifery clinics as well as birthing centers, similar to what we see in the Quebec model. In that Quebec model, midwives hold prenatal clinic, postpartum clinic in the birth centers, and also women come there when they're ready to deliver their babies. So unlike hospitals, they don't have to be open 24/7. You don't need staff on site 24/7. Midwives already have an on-call system. They are available for their clients, and they come to their clients when they're in labor. So that would work in a birth center setting as well. A midwife would meet her client at the birthing center. And we know from past analyses by the Ministry of Health that hospital birth attended by a midwife already provides cost savings to the system, but the largest cost savings are for out-of-hospital births. Additionally, to the cost savings, just institutional cost savings, are the lowered intervention rates that Julie mentioned, and particularly cesarean section rates, as well as the early discharge that midwifery clients have. So in the hospital setting, midwifery clients, about a third of them are discharged from the hospital within 6 hours. Because midwives provide postpartum care and follow-up in a home setting, it's a minimal use of hospital resources. Another 30% within 24 hours. So 2/3 of our clients, pretty close to 2/3 of our clients are home within the first 24 hours and receiving care in their home, in the community. Because of this comprehensive follow-up care, we have a very low readmission rate to hospital, and we believe birth centers would continue to provide that type of comprehensive care and those low readmission rates. Investing in midwifery-led birth centers is an investment in excellent, evidence-based, and cost-effective care that supports normal birth. So now we're going to hear from Kate et al., a midwifery client, Kate Greenslade.
Hi, I'm Kate Greenslade. This is my daughter Vi. She'll likely interject. Vi was born in Leamington, Ontario, and I have sort of a unique experience in that I came originally from London, England, where birth centers are very common and part of the norm, and arrived in Windsor, Ontario at 36 weeks pregnant, looking for a midwife and a place to have Vi. I was given the option by my midwife of looking around different hospitals. And for me, although I wasn't sort of emotionally or I guess emotionally prepared to have a home birth. I was expecting to have my baby born in a birth center in London and didn't really want to have it in a hospital. So I looked around and I found a small hospital in Leaming, Ontario, which I felt mimicked the experience that I might have in a birth center in London. It was a small hospital. My midwife was able to give me a completely natural birth without any intervention, which is what I wanted. And the follow-up care of 6 weeks after having the same woman who delivered the baby come to my house and help me with all of the other things was invaluable to me, especially I think, as I think one of you mentioned, if you have an emotionally trying pregnancy, or if maybe the home isn't the right place for you to have the baby, the birth center is a really important third place to choose. I found my midwifery care in Windsor excellent, and I was really happy to, in fact, to have the baby. Although the moving at 36 weeks pregnant was very difficult for me, having had a midwife and having had a smaller experience where I could have my family present in the room with me. As I said, was just invaluable. Yeah, we were happy to be there. Okay, and maybe not so much anymore. I'm not sure exactly. I'm sorry, it's distracting with her, but I think that's basically the main gist of what I wanted to say here is that I think that Ontario women really deserve to have that third choice, and it's my experience in London amongst my friends and my colleagues that people feel, I don't know if this is a true statistic or an emotional statistic, but people feel when they're in a safer environment that they have an easier birth with less intervention. Thank you.
Thank you, Kate.
Bye.
Thank you. So in closing, really, we just want to say we're here today to call on all the parties to support birth centers by incorporating them into their party platforms. We believe it's time for women and families of Ontario to have access to this option. The public support for birth centers exists, as I think we will see in the upcoming election campaign. And I believe with political will, we can make birth centers a reality in Ontario. Thank you for your interest, and I'd be happy to answer any questions.